Hello and welcome back to Dr. Carri's Clinical Corner. And today I'm going to be talking about Kegels and pregnancy specifically and why I don't recommend Kegels in pregnancy. So I think you're going to find a lot of people, birth workers, birth educators, OBGYNs, who recommend Kegels in pregnancy. And I think it goes along with everything else you find on the internet, like Kegels are the answer for everything, when in reality they're not. I'm a pelvic floor physical therapist. This is what I study. This is what I do in the clinic every day. This is my expertise. And I would say even OBGYNs, this is not their expertise. OBGYNs are medical doctors. They're good at the medical side of things. But pelvic floor muscles, Kegels, are an exercise. And physical therapists, we're the experts in exercise. And then pelvic floor therapists, we're the experts in exercise of the pelvic muscles. So I would say I have the most expertise. And that's not like to knock down anyone else, but just I've spent a lot of time, a lot of money, a lot of investment learning this stuff. And so there's a reason why I'm the expert and other pelvic floor therapists. So a Kegel is a contraction of the pelvic floor muscles. It's named after Dr. Kegel, okay? Like this OBGYN, male OBGYN back in the day who discovered doing these exercises could help women with incontinence. Yes, I agree with that. But what we're doing is we're strengthening the muscles of the pelvic floor. And I disagree with this in pregnancy because if our goal is to prepare for childbirth, and specifically for a vaginal birth, those muscles need to open. They need to stretch, they need to open, and we want to not squeeze when we're trying to push a baby through, right? So do I give my pregnant patients Kegels? Sometimes, yes. If they have symptoms during pregnancy, like let's say they have bladder leakage, they have weak pelvic floor muscles, they have prolapse symptoms, they have something and we test it and they have weakness in those muscles, yes, I will give them Kegels. But for a person with no symptoms who just hears from a birth educator or from their OB that they should do Kegels, no. Just no. I would say like a lot of people I see in the clinic during pregnancy who have no issues, they're just coming in for an assessment to prepare, to learn about their body. I don't give them Kegels. If the muscles are doing what they should be doing, they have no symptoms, they have no problems, no Kegels. In fact, I teach the opposite. So again, oftentimes people come to me in the clinic during pregnancy because they want to do everything they can do to prepare for a vaginal birth. Maybe they want an unmedicated birth. Maybe they want an out-of-hospital birth. And so they want to learn about their pelvic floor. And sometimes people know, like, they want an epidural, they want a hospital birth. They also come in the clinic during pregnancy to learn. There's value in all of it, no matter what kind of birth. If you're having a planned C-section, probably don't need pelvic floor therapy during pregnancy because for medical reasons or whatever that you need a C-section. But when we're talking about the pelvic floor, so a lot of times what I hear, there's one certain birth education class that they teach their clients, like you should do 100 to 200 Kegels a day. I hardly give that to anyone. I give that to a few of my patients who have significant weakness. It's prescribed for men after they have prostate surgery who have significant weakness. But for everyone else, I generally don't give them 100, and especially not at one time. Because what happens is we get sloppy, right? If you're like, I need to bust out 100 of these, it's going to be like squeeze, 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 and it's no good. In the clinic, when I give people Kegels to do, I'm very specific. Squeeze for 1 second, relax for 1 second. Squeeze for 5 seconds, relax for 5 seconds. And I tell them, be very intentional about how much you relax, just as how much you squeeze, right? It's not about doing 100 Kegels or 30 Kegels or even 10 Kegels. It's about being intentional and getting those muscles to work. So I think that's the number one problem. I think OBGYNs aren't really educated in muscle exercise. That's not their education. That's not their expertise. And so they're just like, do a bunch of Kegels, right? Birth educators, they're not educated in pelvic floor exercise. They're just sort of like, this is the program I teach, I believe in it, it worked for me, whatever. But they're not experts in pelvic floor muscle exercise. So they're just teaching a program because often birth educators are teaching a certain philosophy. So they have to teach whatever the curriculum is. And I'm a huge believer in birth education. Like, go take a birth education class. Take all of them that you want. I think there's a lot of benefit. This is just one thing I disagree with. So when women come to me during pregnancy to prepare their pelvic floor for birth, we don't do Kegels. On occasion, yes, if there's a problem, but mostly I'm teaching them the opposite. I'm teaching them how to breathe, how to push. We actually test not just Kegels, so Kegels are tightening and strengthening, and pushing is the opposite, because obviously in birth, the uterine contractions are what's pushing the baby out, but we want your body, your pelvic floor muscles to work with that. So normally when something hurts, we tense our muscles to protect. That's a normal reaction. But we need to sort of override that in vaginal delivery, and we need to open those pelvic floor muscles. We need them to relax as we push. So that's why I don't teach Kegels in pregnancy. We practice pushing. And if nothing's wrong, if you can do both, you can do a Kegel, you can push, your pelvic floor muscles are relaxed when they should be, they turn on when you want, they turn off when you want, you have nothing to practice. And I think a piece of why doctors and birth educators teach Kegels is to help you get in tune with your pelvic floor muscles before birth, which, yes, I agree, there's benefit in getting in tune with your pelvic floor, but I don't think Kegels are the way. So I actually teach people perineum stretching, which is another video. And I know there's some controversy on the studies behind that and how effective that is. But if you want to prepare for birth, you got to practice pushing and you got to practice perineum stretching and what that discomfort feels like. And can you breathe? Can you relax through that, right? And so I think birth education classes can teach you some of those coping skills as well as pelvic floor therapy, just we're more specific about the pelvic floor muscles. So that's my approach. We're not doing Kegels unless there's a reason to, and that goes to my approach for all pelvic floor issues, because Kegels are not the end all be all. They're not the only thing we do in pelvic floor therapy. No Kegels, we practice pushing, we practice perineum stretching, we practice different birthing positions, we practice breathing, and you can find that all. I have an online course, Preparing Your Pelvic Floor for Birth. You can find that there, I'll link it below. And that's really my philosophy on Kegels in pregnancy. Not necessary unless there's a specific reason. So go check out my course to learn more about what you can do to get in tune with your pelvic floor for childbirth.